So I'm going to demonstrate how to place a Foley catheter. It's really important to preserve your patient's privacy and make sure you explain the procedure. Ask them if they've ever had the procedure before. If they haven't, kind of while you're doing it, tell them what you're doing. And then you want to pull the sheet up and let them know you'll be exposing them a little bit and make them comfortable. So you need an order for this procedure, so make sure you check your order and then ask if the patient has any allergies, because usually these kits have betadine in them and latex, so they could be allergic to either of those. So you would do hand hygiene, and then you would come over to your kit and undo your kit, and it comes in like this sterile field. So you want to make sure the first thing you do is put on your sterile gloves that are at the top. Let's just do that real quick. Sorry, these gloves are really small. And you want to do it in the sterile way, putting on the gloves. And then you can just put that aside in your garbage bag. And then you have, in your kit, you have a drape, just a regular drape, and you want to put that underneath the site here, under their buttocks, and let them know that you're doing that. And then you have the sheet with the hole in the middle of it that you're going to place over the urethra area to keep it from getting contaminated. And then my kit doesn't have betadine, it has alcohol swipes. So I would open this package, and then I would clean to dirty on one side of the labia, dispose of the wipe or swab, and then do the other side of the labia and dispose of the swab, and then do down the middle, and make sure I use all of the swabs they provided for me, and then that'll go in the garbage. And then I want to connect my syringe to the catheter, like so. Connect it right here. And then remove the catheter from the sheath in the sterile field. And then I want to make sure that the balloon works. So just, I'll put a little bit in there, make sure I see it pump up, and it did. And then I want to put the lubricant that I have in my kit on the tip of the catheter here. And then I'll let the patient know what I'm doing and let them know that they're going to feel, pressure. And I would insert it into the urethra here and keep inserting until I see yellowish urine. And then insert a little more to make sure that it's in the bladder completely. And then I would fill up the balloon with my syringe all the way. And then I would pull on it and make sure that it's secure. And it is. And then I would remove my syringe, throw that in the garbage. And then I would essentially just tape it to the thigh over here and make sure I put my label on it, and then have the bag attached to the bed and nothing movable at all. And then for a woman, I would essentially do the same thing, or a man, I would essentially do the same thing, except there will be no labia to clean. I would clean with the technique of the penis going in the circles. And then if they ask for a sample and you've already put the cath in, you can take an empty or a syringe, and in this part right here, you can aspirate it out and fill up your sample cup. And then when you want to remove, what you're going to do is take an empty syringe and make sure it's all the way down and insert it in, and the pressure will pull the liquid out. And you want to make sure you got all of it. It usually says right here what it's capable of holding. Mine's 5 to 10. And then you would just, you know, with sterile technique, take it out. And that's it.